Great. So those who missed, they can just look into this. So if you see, if the participant is making just a smallest mistake, the chest is not moving front, the erector spinae is not involved, the gluteus is not involved in the practice, which was actually intended for the practice. See, one mistake has made so many changes. So you need to understand one small thing, that right alignment in yoga posture is must. If you don't give that right alignment in the yoga posture, you are doing everyday injury, because आप रोज वही कराने वाले हो. You are going to make them practice the same common mistake, not correcting them. Okay, अब suppose the sitting bones lead the movement to the rear. Suppose यहाँ पर you have not properly anteriorly tilted the pelvis. In this scenario, you will create more load on the gluteus maximus and also the erector spinae. So understanding this, let's come back to our first. Just a second. Just a second, everyone. Okay. So, but this first example, we can understand the actual muscles involved in the practice and what are the stabilizer muscles. In the next diagram, let us understand the stabilizer muscles. I'll explain you the deep about it. In the Utkatasana, let us, here the muscles are marked. This you can see transverse abdominal muscle. These are the abdominal muscles. You can see the quadriceps femoris. You can see the gluteus medius, which is inside the gluteus maximus. This is also involved, but this is stabilizer muscle. Hamstring, this is assisting in the hip extension. And gastrocnemius and soleus muscle, which I was mentioning in the earlier, gastrocnemius and soleus. Right? Now coming to the erector spinae. So these are the erector spinae which are running through both the sides of the spinal column. And this is necessary to help the chest protrude in front. So this will be an important muscle. So up now, if we understand, the target muscles are quadriceps. What are quadriceps? There are four group of muscles: rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis, and the gluteus maximus. The Utkatasana is basically focused on these muscles. And then you have the muscles which will help to stabilize the posture, which is erector spinae, which you can see over the side of the spine. Of course, deltoid, abdominal muscles. See, let me give you a small formula to remember all the four abdominal muscles, which you need to focus on many postures. So remember that as the word tire, T-I-R-E. Now, T stands for transverse abdominis. Okay? I stands for internal oblique. R stands for rectus abdominis. And E stands for external oblique. So if you want to remember the four important muscles of abdomen, you remember it as tire, T-I-R-E. Let me again tell about all the four. transverse abdominis, which is a deep muscle, internal oblique and external oblique, which is on the sides, and the rectus abdominis, which you know as a six pack or eight pack muscle. So if you take up just one posture, understand how many things are involved in doing this posture. And that's why we need to incorporate understanding and practice. All these things are should be focused while doing a posture. So hope with this one posture you get an understanding. If I teach you about all the yoga postures, and if I teach you how and what muscles are rightly involved, this will help you in two ways. If you are a student, it will help you to remember your anatomy properly. If you are a yoga practitioner, it will improve your yoga practice. It will improvise the way you are teaching yoga, and you will be more scientific, and actually we will be the expert yoga practitioners. See, we have learned anatomy, but we don't apply it. The yoga practices are just done as a traditional yoga. But I, as a yoga practitioners, and you all doing yoga as a part of your studies and therapy, you need to understand that you need to apply this knowledge. So hope this particular slides help you to understand about the basic muscle involvement in doing one simple posture called as Utkatasana. And let me tell you, if someone performs this posture every day, they are going to keep their abdominal muscles strong, they are going to keep their knees strong, and the overall body alignment and posture will be excellent. So make sure that this practice should be done repeated for at least 15 to 20 days every day. They should practice that Utkat Asana, and where you are able to involve all the muscles while doing these postures. Hope this helps. Now let us take another posture for example. Now what I had shown you earlier was the contraction of muscles. In this, their maximum muscles are in a contraction state. Now the second posture what I am taking is a stretch posture, which is a trikonasana. So whatever the yellow muscles you are able to see over here, these are basically lengthening muscles. So these muscles are going to stretch and lengthen while you are performing. So while you're doing a trikonasana, understand which muscles are basically involved while doing this trikonasana. We commonly say it as a hamstring. So you don't only have, if you are doing trikonasana, it is going to stretch the hamstring. No, understand everything which is involved doing this posture. So target muscles are hip adductors, external oblique. I had just told you about the tire, the abdominal muscles. Now this is a very important muscle, quadratus lumborum. See, most of the people suffering from low back pain, the major culprit is this quadratus lumborum. The weak quadratus lumborum is the major cause for back pain presently suffering, seen majorly in the youngsters, students, and I have so many IS parts, students come to me, those who are preparing for the competitive exams. So they often complain me of the low back pain, and the reason what I could assess, diagnose was the weak quadratus lumborum muscle. We'll be seeing this. So while you're doing Trikonasana, these are the muscles which are getting actually worked on. Hip adductors, external oblique, quadratus lumborum, hamstrings, and the gluteus medius. Let us understand this. Even while you're turning your neck in Trikonasana, there is involvement of small muscles like sternocleidomastoids. So if I show you here, these are the adductor group of muscles. What are the adductor group of muscles? Pectineus, which are there in the front, adductor brevis, which you can see as a green, adductor longus, adductor magnus, and gravitalis. So while you are doing Trikonasana, this is going to basically work on all the hip adductor muscles. So the target muscles are these muscles. Now, if you see, I'll be showing you the quadratus lumborum. Um, if, so these are the hip adductors, which you can see here. These muscles are basically stretched and active to stabilize the body. At the same time, external oblique muscles, a multifidus muscle which is inside, the hamstring muscle which is involved. And what are the common mistakes? If you have weak sternocleidomastoid, then if the person practicing Trikonasana will complain of neck pain. If you have tight pectoral muscles, it will not allow your hand to open. In that case, first we need to open up the pectoralis muscles, and then they'll be able to do this posture properly. And one common mistake is the tight hamstring, which will not allow the participant to bend or move their hand towards the floor. In that case, normally it is advised to use props like blocks and all, which you would have already done or you may be using for the practice. So these are the hip adductors, and Trikon Asana is focused to stretch these adductor muscles. What are the adductor muscles? I have already shown to you here. These are the adductor muscles, along with hamstring, which I will tell you in the coming sessions. So as of now, I have shown you two postures, Utkat Asana and Trikonasana. So do you have any questions related to this? Or shall I move towards the further slide?
So can you please explain how the back pain arises in Trikonasana you were telling in between?
No, back pain does not arises in Trikonasana if your quadratus lumborum muscle is weak, which is there in the lower back. Wait, I'll show you the quadratus lumborum. Is there another slide? Okay. Somewhere here is the quadratus lumborum muscle. Okay.
Yes, sir. Okay.
So what the problem is, there is the shortening of the quadratus lumborum muscle. So if you perform this Trikonasana, it will help to stretch that quadratus lumborum, and it will help to heal the back pain. It will not cause back pain, it will heal the back pain. But the major reason of back pain is the tight and the shortened quadratus lumborum, which is there in the low back. Okay?
Okay, sir.
Yeah. So any more questions related to these two postures?
No, sir.
Okay, fine. Let's move. So let me just quickly revise before I move ahead. First posture is Utkatasana. In Utkatasana, the target muscles are quadriceps femoris and gluteus maximus. But we need stabilizer muscles like erector spinae, which is on the spine, deltoid, the four abdominal muscles, tire, which I gave you the formula to remember. Apart from that, gluteus medius and the calf muscles, gastrocnemius and soleus. The second posture I taught you about Trikonasana. Trikonasana is basically a stretch posture. Utkat Asana is basically a contraction posture. What muscles are stretched in Trikonasana? So I told you the hip adductors are the muscles apart from external obliques, quadratus lumborum, hamstring, and gluteus medius. These are the muscles which are getting stretched while you are doing this particular posture. Utkatasana, I told you about the muscles getting contracted. In Trikonasana, I am telling you about the muscles which are getting deeply stretched. So how many muscles are stretched here? These are the muscles. So if you see the group of adductors, you can find it here. Adductor brevis, longus, magnus, and apart from that, gracilis and pectineus. Quadratus lumborum, which is again basically it is a deep square-shaped muscle in the lower back that originates from the pelvis and the 12th rib, and it inserts on the lumbar vertebrae. What the muscle I was talking about, lumbar quadratus lumborum. Its primary function is to stabilize the spine and especially towards the sideward bending. And those who are sitting for longer time, because it is a deep muscle, it will tend to get contracted and will cause back pain. So if you are practicing Trikonasana, it will definitely help to heal the back pain. Okay?
Okay, sir.
Yeah. Now we are coming to another posture, Bhujangasana. Okay. Now these are the common postures which are being told for practice of back pain. So here checking the alignment is important, how the neck is. We are not moving the neck backwards. Many people, what they do is they overextend the neck. So you don't have to, you have to just keep the elbow fold, shoulders down. You will have few sets of muscles which are getting contracted and few sets of muscles which are getting lengthened. Now, why I have taken this posture, particular posture, is to make you understand one common thing. As of now, I had shown you one posture with contraction, one posture with only stretching. Now I am showing you a posture which will be a combination of contraction as well as stretching. Let's see that. What are the target muscles? The target muscles in doing Bhujangasana is the erector spinae muscles, which are basically getting contracted to protrude the chest as up. Just recollect, while I was telling about Utkatasana, I had told you that in Utkatasana also we have to protrude the chest, and that needs a erector spinae muscle. Now the same action is going to happen over here, where the erector spinae muscle should contract deeply so that the chest can move front. Now when this action happens, it will help to lengthen the front of the body. What are the four muscles? The abdominal muscles, that four abdominal muscles: transverse abdominis, internal oblique, rectus abdominis, and external oblique. Apart from that, two more important muscles, which are psoas major and iliacus. So see, if you are performing Bhujangasana, there are a group of muscles which are getting contracted and another group of muscles which are getting stretched. Suppose if someone has weak abdominal muscles, or suppose I have seen people with so much of psoas major tightness. In that case, they are not able to do Bhujanga also properly. In that case, we need to modify the way the Bhujangasana is practiced. In that case, we have to keep the hands far away from the body and then make it easier to practice Bhujangasana. So small understandings of the muscles will help you to give a upper edge on changing the posture as per the requirement of the person. See, I know that we have to perform the asana in this way, but the person who is coming to you, if it is if he or she is not able to perform, then you need to understand there should be a modification. And those modifications normally we teach those modification, how we can actually properly align the modification that will be helpful for them to achieve the proper posture. As of now, let us understand the muscles involved in the practice of Bhujangasana. Now, let us take one more posture. We are taking another posture called as Uttan Padasana. And now we want, what do we want? The leg should be straight, the knee should be straight, the abdominal muscle should be contracted, the toe towards should be pointing towards the navel. These are the common alignments. One of the leg, or if both the legs are being performed, it has to be done. So, what are the target muscles while you are performing this particular posture? Some people also call it as Ardhalasana. So, let's not get confused with the names. Uttan Padasana or Ardhalasana, everything is fine. The target muscles are abdominal muscles. And you have to remember the abdominal muscles as TIRE, TIRE. T stands for transverse abdominis, I stands for internal oblique, R stands for rectus abdominis, and E stands for external oblique. Psoas major and quadricep. So if you are doing this posture, what are the muscles which are getting benefit? So these are the muscles which are getting benefit. And what are the muscles which are getting stretched or lengthened? Again, the muscles marked with yellow are the muscles which are getting stretched. The muscles marked with red are the muscles which are getting the contraction. To remember, lengthening muscles are the bicep femoris, semitendinosus, and semimembranosus, which are group of hamstring muscles. Now, I have shown you the postures which was focused on adductors, which was the postures which was focused on quadriceps, which was focused on the hamstring. Now let me come to a posture which will help to work on the another set of muscles, which will be the deep inner thigh stretch. This is called as frog posture. So recently I had a case with coccydynia, and the lady, she is 50 years old, and she is not able to lie down supine, or in fact she is not able to sit without a proper coccydynia support cushion. The major problem she was facing was she was not able to lie down supine, so she was not able to get a proper sleep also. What she was complaining was of very tight inner thighs, and at the same time inner thighs means adductors. She was complaining of the tight adductors, so she was not able to sit, so it was difficult for her to practice butterfly also. So we started with this frog posture, and you will be surprised to know that just within 7 sessions of our practice, she was able to lie down supine, and she was able to sleep in a supine posture, and she could get a deep sleep, which she could not sleep since last 2 years. So what is happening in this frog posture? The frog postures, there is stretching of all the adductors. Another example of adductor stretching was Trikonasana. It was just dealt few minutes back. So same frog posture is also helping the adductor muscles. So suppose if you are planning a yoga class and today you have planned that you will help the people with back pain or those who are suffering from too much of pelvic tightness, in that scenario you can just combine the same set of postures which will work on the same set of muscles. Like if the person is performing trikonasana and along with that frog pose that for a longer time, then it is going to help. So the understanding of these muscles will help you to plan your classes also properly. it will help you to plan your class in such a way that you will incorporate a specific group of muscles in a class. Especially, I'm talking all about the therapy, right? So in common yoga sessions, you can practice as per your design. So in this particular group, you find adductor longus muscles all getting stretched. But to perform this posture, some muscles need to contract. These are called as stabilizer muscles, and these are transverse abdominis and serratus anterior, which are on the sides. So today I have given you examples. See, I have breakdown of all the yoga postures. I have breakdown of all the yoga postures in which particular asana, which muscle is involved. So if you study with me for a period of just 2 or 3 months, you'll be so well versed with the anatomy of yoga postures that the way you teach your sessions, the way you teach your classes, the way you are taking therapy, the people will be getting a lot of benefits from your teaching. So that was my intention to teach everyone who is interested about anatomy of yoga postures, and I am doing just as a part of a helping gesture. See, I don't need any monetary support for it. So all these sessions and upcoming sessions, whatever we plan, will be a free session. And this is just my intention to help everyone who is practicing into field of naturopathy and yoga, that they get a good knowledge and they apply into their practice, and we need to raise the standards of our practice. This is my intention for every one of us who are practicing around the India and globe. And all those who have joined today, first of all, I would like to say thank you to you all, so that you took out this time, because you wanted to improve your quality of taking sessions or learning or practicing yoga. So thank you so much for your time. So five postures what we dealt with today was Utkatasana, the quadricep base, Trikonasana, Bhujangasana, Uttanpadasana, and the frog pose. So if you are interested to learn about more postures, I'll help you out. You can join the group um, which is made for anatomy of yoga postures. So we'll be updating the sessions and the upcoming sessions in that. And those who are interested
So,
can keep joining and keep learning and keep improving the way they are practicing yoga. So combine yoga posture teaching with an anatomy connection. This will help us. The conclusion is yoga is both art and science. Let us combine it. As such, it is an art and it's a lifestyle. But if it is science, and as we are medical practitioners, we need to incorporate the science into the yoga practice. And understanding the musculoskeletal mechanics prevents injuries and enrich our yoga practice with safety and depth. So thank you so much for your patient listening, and hope this session could add bit to your knowledge.
so one question is there. Uh, I want to ask, can Utkanasana can be practiced in anterior cord degeneration?
How long the patient is suffering
Since
from,
2 years. 2 years.
and what are the problems he is facing?
She is unable to climb stairs smoothly, and there is continuous pain in her thighs.
There is degeneration of muscles, right?
Degeneration, and in the MRI report, it was written that there is a anterior mucoid degeneration happening in the knees.
Okay, in that case, I think isometrics should be done and Utkatasana should be avoided. You know what are the
Okay.
isometrics?
Uh, I will see. I don't remember it now.
Okay, let me tell you. See, basically, whenever the ACL is weak, normally with the condition what you're telling, the ACL muscles are weak, right?
Yes, sir.
So
Yes, sir.
because ACL ligament is weak, so they are not able to basically keep the knee properly into alignment,
Yes.
and the range of movement will be always limited.
Yes, sir.
Sometimes there is a formation of cyst in their knee.
Yeah, small cyst.
Is it there?
Yeah.
Yeah. So
In
in this scenario,
right knee it's smaller, in left knee it's bigger.
okay, fine. In that scenario, what we can do is we can do our naturopathy treatment, basically the hot and cold fermentation, 3+1 for
Okay.
3 minutes and 1 minute. And then we
Yes, sir.
can go with the isometric, we can use a small medicine ball. And
Okay.
with that particular exercises can be done. You can connect to me personally so that I can share you the list of exercises that can be done in this condition.
Okay. Okay, sir. Yeah.
So thank you so
Thank you,
much,
sir.
everyone. With that, we come to end of our today's session. If you have more questions, you can note down my number, and you can just post your query to me directly. My number is 98261 51203. I am writing down in chat. You can just copy it. So if you find any difficulty related to anything, if I can help, I'll definitely help, or I'll guide the person who can do that. You help. Okay, you want the link for WhatsApp group? Just a second. I'm posting the link into chat. You can join through that. You can join the group Anatomy of Yoga Postures. So those who are interested to learn further about the yoga postures and other yoga postures also. And if you want this slide, I'll share you the slide also. So you can keep it into your records. If you want this slide, I'll share with you. You can share your interest, I'll share with you. Okay? Okay. So let's let's keep connected and keep learning. And I'll share the slide in the group. So please join the group. I'll share the slide in the group so it will be helpful for everyone. Okay? Yeah. Thank you so much. Have a wonderful day.
Thank you, sir.
Thank you.